Welcome to Cosmetic Networks Live, where we explore the aesthetic and the cosmetic industry from the inside out. Hi, I'm your host, Sheila Maitland, and our special guest today is Dr. Douglas Hauck. He's a board-certified dentist from Newport Beach. Welcome, Dr. Hauck.
Hi, how are you?
I'm doing great. How are you?
Good, thanks.
Okay, this is going to be really fun.
Okay, good.
We're going to be talking about celebrity before and afters.
Excellent.
And I've peeked through some of these ahead of time and cannot believe some of the things I've seen. And I'm so excited about what the viewers are going to see.
Fun.
And how you're going to take a look at them and say, here's what they had done, here's what I might have done differently, and you know, all that stuff. So we're going to start with Michael Douglas.
Oh my gosh, Michael.
Well, here's the thing.
How old is he?
I don't know, 30? Don't you think?
No.
Okay, so let's take a look. What are some of the things, what did he have done? What was his situation? Obviously had veneers, right? And
Veneers or crowns, I mean, and this is obviously he's older.
Right. How old do you think he was there?
45.
So these are...
I mean, he's a handsome gentleman. You sure it's not
Well, he waited kind of later in life than to have his teeth done. Because it made quite a...
Well, he married that young girl.
Oh, and so that, like, she had cash? She was the cash cow, huh? So...
Well, go ahead, because it's a nice book. It's before and after. It's quite amazing.
It is. His teeth are definitely perfectly straight, whiter now, smoother at the bottom, thicker, fuller, bigger smile. But I would say that doesn't look quite as natural.
I agree. I mean, they call this in the dental world the picket fence. You know, it's a little too perfect, too straight, too uniform, too predictable, slightly unnatural. Is it a nice white smile? Absolutely. It looks nice, but they call it oh, you must be an American, because the Europeans would just tear this up. All the European models that I've ever taken care of, they always want a beautiful smile and one tooth a little crooked. They don't want to be like the Americans, and so that's always interesting to me that you make this one a little bit crooked and everything else perfect.
Really?
So they have some character, some naturalness to it. And on this one, that's a little bit something there where it might be lacking. It's just a little bit too forced.
I would agree. I would agree. So maybe even his coloring, there's not a lot of depth or definition in the color of the teeth?
Right. So in the colors, there's chroma, value, and hue. Those are different types of light that comes through.
Okay.
And he is lacking. The chromas are too high. The hue is too low. And they're just kind of popping like chiclets. Those little square white gum things, right?
That's exactly what that looks like.
So it's really hard to see. It's easy because you see the before also.
Right.
So you're going from something that's really dark, it could be improved, to something that's a little bit over the top. So handsome guy, could have been better. Definitely
an improvement, but not a natural transition.
Yes, I agree.
All right, let's jump to the next person on here. I'm going to let you take this. This is Cheryl Cole.
Okay, is it bad if I don't know who Cheryl Cole is?
No, but boy, she sure looks familiar.
Well, I think right? Oh, that was 2 years ago.
Oh, there you go.
But her end result's stunning. And so you look at the end and they go, oh my gosh. And then you have to go to the beginning and say, oh my, look at her. So if you take this like this and you kind of look at her canines, these are...
Oh my goodness, total points.
Points, vampire, not only on the canines like most people, but also on the laterals. Looks like an extra small lateral right here, this little itty bitty one. And this is what you can see here. And very thin on the edges of the two front teeth. You can see the shadow or the ghost. So that means her teeth are very thin, and it's probably because her bite's off a little bit, I have to say.
So was she born with those pointed teeth, or because if her bite might be off, they wore to that?
I don't know, quite honestly. It could have been either. Those are both good answers for that problem.
Okay.
But then when you go to the end result...
Beautiful.
I mean, I think this is a really quite nice end game here. It really turned out well. It has full enhancement in the buccal embrasures. The positive smile line is following the wet-dry line of the lip, which is kind of what we follow in our symmetry and what we're looking for. And she shows just enough teeth versus just enough gums, which is not much.
Right.
And so I think for her, it's amazing. So you look at the before and after, okay.
Really
now
nice.
I wish I knew what she did. Oh, here, you're going to love this one.
Oh, this does not look real.
So who's your buddy here? Is this really Tom Cruise?
Tom Cruise. Okay, either it had a little acting part that he was playing and they readjusted his teeth, or someone really got a great shot when he was young.
Yeah, that is one hideous smile for,
actually,
for a young guy.
When you enlarge that actually could be natural.
Yeah, so we all know that Tom has a nice smile now, but it wasn't always that way. And if you really look at Tom's smile over all the photos and films, his midline is missing. In fact, I think he's missing a lateral tooth.
Okay, show me.
Everything is shifted over. It's almost fixed now, but because they've hidden it.
I see.
But his teeth are actually shifted over about 2 millimeters to one side.
Okay.
And this is the good version of the repair. But before that, in earlier films, you'll see that he is actually way over.
Okay. Wow.
If you're a dentist and you look at all the movies he's done, we all stare at those and go, "Oh my God, how are we going to? Who didn't get that?
Can that be fixed?
Well, that's the fix, and I think in general they did a decent job.
I see. Wow.
So that's So if you go from this before to this after, it really is amazing.
It is amazing. I almost didn't believe that in the beginning. Then when you enlarged it, you could see.
Do you think the studio paid for all this?
The studio that did that he works for?
Yeah.
100 times over.
Right. Yeah.
All right. Do you know this guy?
I don't. Is it from the Hansons? I don't know.
I don't know. So let's skip on.
Okay.
Kate Beckinsale.
Okay, so she's a famous actress, and she does a lot of great work. And this person here does not look like this person to me. Are you sure it's the same person?
I'm not sure, but let's pretend it is.
It is actually. But the fun thing here is that there's not much in the smile design change here, other than the fact that her lipstick's totally different, her skin tones are totally different.
Her smile's a little bigger in the other one.
So we go over to the final here, and you see that the laterals are filled out a little bit more, but there's still a little bit of a problem right here. This one's looking flat and flush to the camera, where this other lateral is turned inwards. So this side could be improved if you ask me. I don't know if that's natural or not. I can't really tell.
So with when you say this side to be improved, just a couple of teeth, or would you have to really kind of give her a full new replacement?
We'd love to do them all. Speaking as a dentist, but also, you know, when you do smiles, you want continuity and symmetry, and they're all custom made by usually one ceramist. They can be custom made by the same ceramist differently on a different day. You know, they're all handmade. So you want to get the same guy making the same batch at the same time.
To get that perfect result smile, because it's kind of hard to go in.
The perfect result, they have to all be remade. Can you try to match them up? Absolutely.
I see.
And the results be excellent? Yes. It just, in the perfect world, we'd like to have them all done at the same time.
And I think that's great for people to know. They know that they can still come and get just one tooth that's maybe either shifted or they've broke it or something repaired.
A dark tooth, a broken tooth, a dead tooth, a chipped tooth. One is fine, but also if you want the real finale, you might have to do more.
You know, speaking of dead teeth, what causes that to happen and what is the repair for that? Because that's not when a tooth goes dark.
Right, it's a dead tooth inside. That means the nerve is dead, the nerve is died inside, they go in and clean out the inside, they fill it up with a inert material called gutta percha, and then the color of the tooth will change color. So we have to hide the dark that comes through, and usually it's a crown or a veneer. Hopefully it's a veneer. And nowadays we're using lava, which is a very white core, metal-free material.
And is that a painful repair?
No.
Good, good. Let's move on. Steve-O. Oh gosh, darn! I saw this guy live.
Did you?
Oh, for my girlfriend's birthday.
So what do you think?
I was speechless.
Was he wearing his pants?
No. Stripped down, totally naked before we left. I am not kidding you. My mouth was dropped. I could not believe I was sitting in that audience.
Okay, but here's the thing. We're only talking about teeth right now.
I know. So go back to the teeth and away from the body.
Yeah,
Yellow.
So what's the deal with those teeth?
Ooh, they are naturally seasoned.
And you saw them up close and personal, so are they really like that, or?
I don't know. That's what it shows. Let's see what we got. Well, he had them whitened for sure.
Yeah, he's kind of a goof, isn't he?
He's a goof.
Yeah, but I mean, I'm sure he's got many root canals, and I know he's broken a few teeth, but at the end of the day...
It's because he eats everything, and it's quite obnoxious.
Yeah, doesn't he jump off buildings and crash things?
Obnoxious.
Yeah. So, I mean, I still think it's a good result.
Right.
This is yellow, this is white.
So you're thinking this is just whitening, or is this actual
No.
veneers?
This is crown work.
So you can't get your teeth this white when they're that yellow naturally?
It'd be a long shot.
That's a lot of shades.
Yeah, it's really probably not going to work. I have seen him crash on his teeth before. I think I've seen him lose a few teeth. So I know he's got some problems.
All right, good to know. Who's this? Nicole Roberts.
I mean, and look at this. I mean, that is a short, teenage yellow smile.
Teeth coloring, yeah.
Okay, and the canines sticking out there, nice blue eyes, right?
I see a silver filling back there.
Oh, look at good eyes.
Uh-huh.
And I think that's a nice result.
Very beautiful.
So now this is a color that's not way over the top.
Right.
It just is fitting her skin tone at the moment. You know, maybe she is a little bit of a redhead, but redheads usually have a fairer, whiter skin tone, and their teeth will be a little different color as well.
Oh, so what is their
different nationalities and different races have different stump shades and final colors. So, you know, this is, I don't know her nationality, but English, Scottish, something like that. And so you
red
get
hair, light skin.
you get a little bit of a thinner tooth, and you get a little bit, if you want the natural look, a little bit more layers of porcelain or layers of colors. as opposed to that flat white.
Okay. So when you're picking colors for a patient, how do they go about doing that? How do you go about doing that?
Well, I have to talk to them first to see where they're going, because they say, oh, I want, Julia Roberts' smile. Okay, well, you're not Julia Roberts, so you can't necessarily have her smile. It's just not going to work. So you have to bring them to where they're at.
Okay.
And then you say, okay, what do you expect in your eye? What do you want to see? I want white teeth. Okay, great. So then you start pulling out some colors and you start trying to figure out where they can go. And then I have to look at the color of the base color, or they call the stump shade, and what we're going to be fighting to get to that color. And there's a whole program on taking where they're at to where they want to go, and how much you have to block out the natural color. For me, when I do my smiles, I try to allow 10% of the natural color to come through. I might want to get rid of all the yellows and all the grays, but I still need some natural tone. And then I have to be able to stack the porcelain many, many layers so the light goes in naturally and comes back out naturally, as opposed to one flat layer.
That's quite a process.
Yeah, and that takes extra ceramics time, extra lab time, extra knowledge, and it's more expensive.
Right. Okay, so then when you talked about asking the patient, what color do you want? They want white. Well, you probably hand them a variety of 100 white options, right? So do they just automatically, organically go to the lightest white? So that's when you have to bring them back down in and say, well, let's look at where you're at now and how drastic do you want this to be? How natural do you want this to be?
Yeah, what do you do for a living? I mean, do you really want that white? Because it can get a little bit much. Like Michael Douglas we saw was a little bit flat white. And there's different kinds of white where this is not flat white.
Right.
So that's where I have to take, what's the material we're going to use, what's this color inside, how are we going to do it? That's my job. How are we going to get them from here to there and get them happy?
Great.
It's kind of fun.
Yeah, really fun. Melanie C.
Don't know her, but she's missing a tooth or something. What is that, a gold tooth?
I don't know. That looks like maybe.
Is she a rapper?
That looks like a gold tooth. Definitely.
That
and I thought that was a boy actually in the beginning with that tooth there, but
a transgender?
Maybe. So what do you think?
I think she's transgender.
Okay, so what what was the process here?
Hey, but back in the days, gold slip crowns were all the rage. Madonna had one. You go to this guy in Houston, he'll whip up a little slip crown for you. You're a rapper for the day.
Is that just something you slip on it and get pictures taken?
And this one guy is like, yeah, this is for the show, and then he takes it off, and then this is for mama.
Oh, funny.
So these can be permanent or can be temporary.
I see.
And they're kind of a fun gag. I have done diamond, I have done ruby, I have done gold.
Embedded it in the tooth?
Uh-huh.
Wow,
that was like 20 years in Beverly Hills. You end up doing a lot of funny things. And not what I chose, it's what they chose. And
how does that stay in?
On the stones, they're glued in.
Wow.
And kind of funny. You know the rock stars. They're very entertaining.
Very common for them to fall out, though?
No.
No? Wow, that's amazing. So anyone can take their earring and put it in their tooth? Right?
A pierced tooth? I don't know about that.
Oh, well, the diamond out of the earring and stick it in their tooth.
Anyhow. Her smile turned out nice.
Okay, yeah. So what was the condition here and how
so
did it
this, in my opinion, this is veneer. So we're going from obviously this gold tooth and some gummy smile to a more of a balanced smile, less gummy, and obviously a no gold tooth, which is her mom probably liked.
So she probably had some laser on top as well.
Some laser and some veneers, and it looks like she's had at least 6 done, maybe 8, because we need to go back a little bit. So where you stop your veneers is really important as well.
Right, definitely. So it makes it look like a natural transition. David Beckham.
Okay, well, who's as handsome as David Beckham, right?
Right. He's handsome.
So obviously, what do you see there?
Well, I see a couple teeth that I've recognized before. It's almost like a dwarf teeth.
Stubbies?
Yes. And that's a birth, right? It comes with birth.
Right. Those are peg laterals, they call them. They're very short teeth, underdeveloped usually, and that's natural for them.
Right.
Some people are genetically just like that. Like, I have no hair, he has little teeth. But look, his result was quite nice at the end of the day.
Beautiful.
He's a handsome guy. He gets paid a lot for that smile and whatever else. And, and he uses it well, right?
And that's a nice big smile.
It is.
It looks really, because I don't think before it was quite as big. Well, they were brought out and made some.
Well, also, people are excited to smile when they have a beautiful smile, right?
That's a good point.
And so this might not be anything was done. It's just other than he's learned how to use what he's got now.
Right.
And
looks really nice.
Yeah. So there it is. That's a little bit of a wrap up on
that was fun.
right?
I love going through those, all those before and afters, and the shock at value of seeing them here, and then when they switch, it's like, wow.
So I'll have to bring in some other ones down the road here for you.
Let's do that. And you know what I love that what you do is life changing. You're changing these people's lives to where they can be confident and just happier with who they are and how they feel and how they look.
Changing lives one day at a time.
That's right. Awesome.
One smile at a time.